Who was the first survivor of rabies without the vaccine? Hi everyone. Today I'm going to talk about one of the rarest stories in medical history, the first person known to survive rabies without the vaccine. This lecture discusses a unique and experimental treatment used in a rare case of rabies survival. While promising, it is not yet a proven or standard cure. This is for educational purposes only. What is rabies? Rabies is one of the deadliest viruses known to humans, almost always fatal once symptoms appear. But in 2004, something unprecedented happened. A teenage girl survived rabies without receiving the vaccine in time. This presentation dives into that groundbreaking case, the experimental treatment that made it possible, and what it means for the future of medicine. Why rabies is so scary? Rabies is transmitted through the saliva of infected animals, usually through bites. The virus travels along the nerves to the brain, causing inflammation, hallucinations, paralysis, and eventually death. Once symptoms appear, there's almost no going back. Is rabies completely preventable? Yes, rabies is nearly 100% preventable with vaccination, especially if administered promptly after exposure and before the onset of symptoms. Rabies vaccines are highly effective and safe, and prompt treatment can stop the virus from reaching the central nervous system and causing fatal illness. Rabies is preventable if treated immediately with a series of vaccinations before symptoms appear, but it continues to cause approximately 55,000 deaths each year, mostly in Asia and Africa. These deaths often result from misdiagnosis, delays in treatment, or lack of access to medical care. Even when treatment is available, the cost of vaccines and immunoglobulin therapies remains out of reach for many people. Jeanna Giese, the first known survivor of symptomatic rabies. In 2004, a groundbreaking medical intervention changed what had long been considered a death sentence. A teenager from Wisconsin, Jeanna Giese, became the first known person to survive symptomatic rabies without receiving the vaccine beforehand. This was made possible by an experimental approach known as the Milwaukee Protocol. The case of Jeanna Giese. Jeanna was just a normal high school student. One day, she got bitten by a bat during church. The bite was small, and she didn't think much of it, so she didn't get the post-exposure vaccine. 3 weeks later, she started to feel sick, tired, dizzy, trouble walking. Then the symptoms got worse. That's when doctors realized it was rabies. And it was already too late for the usual treatment with vaccines. Rabies is almost always fatal once symptoms appear, and at this stage, the traditional treatment with the rabies vaccine and immune globulin would not help her. The Milwaukee Protocol. Dr. Rodney Willoughby, Jr., one of the physicians involved in her treatment, devised a novel strategy in an attempt to save her life. The idea was to place her into a medically induced coma, effectively slowing down brain activity. This was intended to shield her brain from damage while giving her immune system time to produce a response to the virus. Alongside the coma, doctors administered a combination of antiviral medications. This innovative treatment, which combined sedation with antiviral drugs, would later become known as the Milwaukee Protocol. The Milwaukee Protocol's principle. Rabies typically causes death by interfering with the brain's ability to control vital functions such as breathing and heart rate. Victims often die from respiratory failure or fatal heart arrhythmias. Unlike many viral infections, it does not directly destroy brain tissue. The Milwaukee Protocol sought to give the body a fighting chance before those vital systems shut down. The fight for her life. She was in a coma for about a week. Then, slowly, they started waking her up. At first, it didn't look good. But then something amazing happened. She started responding. She had to relearn everything: how to walk, talk, eat. But she kept improving. After 76 days in the hospital, she went home. Recovery was long and involved extensive rehabilitation. Although she experienced some minor neurological effects, mainly in speech, her cognitive abilities remained largely unaffected. She later went on to attend college and live a relatively normal life. After Jeanna, does it actually work? After Jeanna, doctors around the world tried the same protocol on other rabies patients. It's been attempted over 40 times. But here's the truth, it didn't work most of the time. Only a few other patients survived, and in many cases, the outcomes were tragic. That's why this treatment is still seen as experimental. Dr. Willoughby speculates that Giese may have been infected with a rare, weakened strain of the rabies virus, but he also credits her survival to a combination of intensive care, the coma, and, in his words, 10% sheer luck. As of now, researchers are still unsure exactly why she survived, and the Milwaukee Protocol has yet to be proven effective in other patients. Hope versus hype. Jeanna's case gave the world hope. For the first time ever, people thought, maybe we can fight rabies. But it also reminded doctors that we can't rely on one-off successes. The Milwaukee Protocol isn't a miracle cure, it's a starting point. And there's still a lot we don't know. The Centers for Disease Control and Prevention, or CDC, is testing the protocol on rabies-infected ferrets to learn more. While promising, the protocol is costly, around $800,000 for a single patient, and its scientific basis remains unclear. Furthermore, the high cost and lack of infrastructure make it a less viable option in developing countries. Final thoughts. Jeanna Giese's survival is one of the most incredible moments in modern medicine. It reminds us that even in the face of something as deadly as rabies, science can surprise us. The protocol might not work every time, but her story opened a door that had never even existed before. Thanks for listening.